Hi, I'm Dr. Christopher Palmer. I'm a specialist in robotic total joint replacement surgery. If you've decided that you need a hip replacement, there's some things you need to do beforehand. I encourage prehab or pre-physical therapy for every patient for a joint replacement for at least a few weeks before your surgery. The pre-physical therapy will be done with a physical therapist, someone who can help coach you along. They will measure you before, they'll measure your strength and your range of motion. That way afterwards, you'll know when you get back to your preoperative function and you'll know you're progressing forward. Other things we want to avoid going to the dentist or any other procedure, anything that could put infection into your body before surgery and before we do a joint replacement. If you're a smoker, we would encourage you to quit. If you can't quit, you have to stop smoking at least 6 weeks before and 6 weeks after. Before surgery, we will give you a list of the medications that you can take or the ones that you need to stop. Some of the most important medications are stopping all of your anticoagulants or your blood thinning medications at least 5 days before. If you are on any sort of medication for rheumatoid arthritis or another autoimmune disease, those need to stop for 1 month before and 1 month after. On the day of surgery, you won't be able to eat or drink anything before midnight unless instructed otherwise. You'll need to come into the operating room at least 2 hours before your surgery. We'll give you that time either the week before or the day before, depending on where we do the surgery. You'll be greeted by the nursing staff. They'll start an IV in your arm, and they'll do some paperwork and some blood work as well to make sure nothing has changed since your last labs. After your paperwork's done, then I'll come and see you. I'll answer any last questions you have. We'll mark your leg, and then we will do what's called a block, which will help with postoperative pain control, and a spinal anesthetic, which will help during the surgery to eliminate pain as well as keep your blood pressure low. And then we will proceed forward with the surgery. What I would recommend as you go through this process is remembering the end goal. It is scary at the beginning, but we'll be there every step of the way. And what we'd recommend as you're going through this is think of where you're going to be in 6 to 8 weeks and the things you're going to be able to do. Keep your eye on the prize and focus towards the end goal.